The vast majority of people who present with hip arthritis have osteoarthritis. There are other forms of arthritis less common, such as inflammatory arthritis, rheumatoid, or ankylosing spondylitis. But the vast majority will be the arthritis that you get from being mature or getting older than you want to be. Both hips don't have to be affected. Very often, one hip is worse than the other. But some conditions will affect one hip very much after the other. And it's quite common practice to have to deal with the other hip within a couple of years of the first hip. So arthritis can be quite painful. It starts presenting with groin pain, which often confuses people. People start thinking, could this be a hernia? Could it be a muscle tear? But the pain in the front of the thigh is often coming from the hip. It stops people from being able to change postures, getting into the bathtub, getting into the car, getting into bed. They often have to lift the leg when they get into the car by the hands, and they find it quite difficult to walk the distances that they were used to. And those can be quite a few of the initial symptoms. Very often with early arthritis, there isn't much logic in rushing to surgeries. And sometimes we would use injections into the joint to try and take some of the symptoms away. When these things don't work is the only time we start talking about hip replacement. Hip replacements should only be considered when it affects lifestyle and independence to a good degree. So when people can't walk more than a few hundred meters, people can't get a good night's sleep, or they have a limp that affects them and how they walk, the amount of painkillers they need is far more than what is safe. That's the time to start thinking, would surgery be useful? It often depends on the treatments. Of hip arthritis with injections and similar will not change the nature of how the hip progresses. So injections are meant to ease the symptoms. But once you have a hip replacement, the vast majority of people, it should get you at least 15 to 20 years of pain-free life. That's the goal of any hip replacement.